Hey, welcome to the March 11th, 2019 meeting of the Yarmouth Board of Health. First item on the agenda is for public comment, and what I would like to do is, if people have something to say, limit it to things that are not on the agenda, okay? And we usually do the other way. So I'm sure that a lot of people here, my assumption is it's all on the same subject, having to do with cigarettes and nicotine and so on. So, anyone want to come up with a comment about anything other than tobacco and nicotine? Okay. All right. Seeing that there are none. If someone's coming up to speak at any point, it's helpful for us just to print your name on the list. That's only for the minutes. It makes it a lot easier for our team here to be able to write up the minutes. So, next on the agenda is the Cape Cod White Ribbon Day, which is March 21st, 2019. And I think we may have someone here from the Independence House. And I see we do.
You can go right to the front table.
Here?
Yeah, absolutely. Have a seat. Nice to have you back.
Just pull the microphone in towards you a little bit.
Thank you. Thank you for having us again. My name is Chris Morin, and I'm from Independence House. I'm the Director of Prevention, Education, and Outreach. And as you know, each year we celebrate White Ribbon Day. Independence House, just for those who are not familiar, we serve all survivors of domestic and sexual violence. Our services are free. We have 4 offices. Our main office is Hyannis, but we also have a full-time office in Falmouth, Orleans, and then once a week by appointment in Provincetown. And our services include children who witness violence, teens, and elders, anybody who's affected by domestic and sexual violence, and their family members. A lot of times we get a call about somebody who knows of a family member, so we would help with counseling for that as well. Our main service is counseling, and I forgot we do have also a shelter now. It's about a year old in November, but we also are charged with prevention, and so. Again, in Yarmouth, we continue our partnership with the schools and with Age Friendly Yarmouth. We sit on that committee, and then the White Ribbon Day, which is our partnership with the police department and the district attorney's office. So Annie Catalano was to be here with the police, but I think she's gotten tied up with some kind of police issue. But so the history of White Ribbon Day is that there was a massacre on a college in Canada in the early 90s. Men also died, but there were 14 women that were targeted. Over that year, the men on campus wanted to create some kind of an awareness around this issue and have men stand up to be part of the solution. Most men don't abuse, but most men don't know how to stop that cycle or stop the language or demeaning language and violence. So the White Ribbon Day was formed back in the early 90s in Canada, and now it's international. So in the last 11 or 12 years, the state of Massachusetts has celebrated it, and now this is our 7th year on Cape Cod. So in the past, we've had the format of a press conference held at the Village Green, and this year, when Annie and I met, we wanted to shake things up a bit. We asked the men present last year, so what are you doing between this White Ribbon Day and next? Because that's what happens. The program happens, but nothing really changes much. So we're having it at the college. We have a new audience. It's at Four Seas College on the 21st from 11 to 1. It'll be in the cafeteria because that is where most people walk through. They might not come to a White Ribbon Day, but they go to lunch and we catch them. And so we're going to have, the purpose of it is to have interaction besides just somebody talking. So we'll have interactive tables. We'll have a table around social norms. We'll have a table around what is rape culture. What are the messages out there through media that kind of support demeaning women? So we're providing these different tables to hopefully have interaction and dialogue about what people really think. In addition to this, so what Independence House did to start the dialogue throughout the year was to form a men's initiative. So we have a men's initiative, which is just getting off the ground. They have a mission statement, but their goal is to meet once or twice a month. Men have conversations around masculinity. There's a new term out there, toxic masculinity. What is that? But also to create a few events throughout the year with young men and conversations with young men. So that we'll have a table there for that, for people to hopefully sign up. The chief of police from Yarmouth and the assistant, I don't know his title, Steve Zaros, deputy chief, thank you, will be there. The chief police, Sonnabend from Barnstable, key people like that, the district attorney's office, will be there, not to give a speech, but to be part of the interaction. That's what the goal is, and that young people can actually meet people who have power and can make some change. So that's a little bit out of the box of what we usually have, but in addition, as a spin-off from our prevention conference last October, the group who attended that from Falmouth are also having a White Ribbon Day on the 19th. So we're excited about the expansion around that. So let's see. Any questions? Or
Why don't you repeat the time and place again for people listening at
sure.
home?
It's at the Four Seas College on Thursday the 21st from 11 to 1 at the cafeteria. And I guess I also would just make a plug here. This is our 40th anniversary commemorative year. And so we'll be having a variety of events throughout the year. We'll be sending out that calendar. You are familiar with the Clothesline Project and the Silent Witnesses. I think last year we brought them here to the meeting. So we are looking for 40 venues to show those this throughout the year. So that's anything that anyone has some ideas about. We'll be probably out in front of the library. We'll be at the Hyannis Green. We'll be at a lot of different places. So again, this is a topic that silence helps it continue to grow. And so our job, especially in my job of prevention and outreach, is to make us visible, where people have to at least think about it or talk about it. So I hope you might join us for White Ribbon Day. But any other questions?
Anything else that this board could do for you?
Well, yeah. I think I mentioned one time when I was here, anything that the Board of Health can do in the way of promoting some of the prevention stuff we do. We have an Enough Abuse campaign, which is about preventing child sexual abuse, and we really, we are part of a collaboration to bring this campaign to Cape Cod. And what it is as any venue of adults, it's education around the signs of child sexual abuse. Why is it a public health problem? And what can we do as adults? Presently, or basically, over the years, we've trained our children to know the proper body parts and who you can trust and what's good touch and not good touch. But that puts the responsibility of disclosing sexual abuse on the child. So this program is really about educating adults to know the signs, not be afraid to report something, look at your own policies of organizations that serve youth to see what you have in place for safety around sexual abuse. That's one thing. And then the Men's Initiative, understanding how violence, there's a direct link between violence as a child and where it goes unnoticed. Many times, it's put under the rug or denied, and the child grows up with trauma. I'm talking to health people, so you know this, but and so the child carries that trauma, and many times abuse is gone, but the trauma is still with them because it has never been addressed or healed. So they make unhealthy choices, and many times the health choices of people as adults are reflective of their behaviors and actions. So they might be overeating, overdrinking, unsafe sex, all those things that lead to physical health problems as adults. So we see this as a key to looking at a total health of a person. Many times we have adults come to us being triggered by an event where they were abused as a child. The abuse is not happening now, but their life has been not a healthy one because of the trauma they've carried. So anything the health department can do around helping us to make that more aware and making these venues possible to bring this education to people, it's very hard to talk about. So we try to be as visible as possible around that issue.
You certainly don't have to limit your visits to once a year here.
Oh,
If you're aware of some model towns where they have bylaws
yeah.
that are appropriate or positive, if that's something you can get to us, that'd be fabulous. It would help us review what we have in this town if we needed it updated. We certainly haven't looked at it since I've been on board.
Right. Yes. Right. That's very common too. So that's one of our ways of being visible is to ask people to kind of look at that. And in May 7th, Jenna Quinn is coming to speak. She is a survivor of child sexual abuse, and actually part of our Enough Abuse presentations. We have a video, a documentary about her family and her family's experience with her being a victim of child sexual abuse, which happened to be her father's best friend and soccer coach. And so that's very, very often it's not anybody, a stranger, it's somebody that you knew or somebody who's groomed you. So we're excited to bring her. We're offering CEs for mental health workers. We're looking for educational CEs, but that would be held at the Cultural Center in Yarmouth on May 7th from 6 to 8. And I can send you that flyer.
Please do. Yeah, get us. Okay.
Oh.
Thank you.
Yeah. So thank you.
Yeah, and you can, for the people at home, we have white ribbons that you want to just explain them, and you can leave a few at the office with us today, so we can, if people at home want to come in and pick them up for this month or any of these events.
Oh, sure. Yeah. Yeah, I can leave you with some. The white ribbon is simply that symbol, and the original day is the first Thursday of March, but that always doesn't fit in people's schedules. It didn't fit in the 4C's schedule. So people can honor it any day of the month, any day of the year, actually. So, yeah, I can leave some with Bruce.
Great.
Yeah.
And just for the people at home, I should say Independence House is one of 12 human services that we support in funding that works out in the community on behalf of the board. So it's a very important program. We have I believe on your board, we have a police officer, or at least one or two that's always been on your board, executive board.
Yes.
And you've worked closely with the police department and the Board of Health over the years.
Absolutely. Yes, absolutely. Just re-emphasize that.
We appreciate that. So I know we always have different various human services come in. It just ties in well when we get the presentation at this time also. Thank you.
Okay. Anything else?
Good.
Anybody?
Thank you.
Thank you very much.
Okay, thank
Thanks,
you.
Chris.
Okay, the third item here on the agenda is listening and educational session, tobacco board discussion, and what's listed there is vaping, and the other is flavored tobacco, menthol, mint, and wintergreen. I assume we have some people here. That's great.
Jess. Got Jess right there.
Anybody can come up in what order. We're all pointing to you, but you're welcome to come up.
That's okay, yeah.
Stand up, and you got it.
Sure, thank you.
All right, welcome back.
Thank you. Prefer if I stand or sit?
Yep.
Sit here. So good afternoon.
Excuse me, just, as I said, just sign or
Yes,
print
of
your
course.
name. You don't have to sign. It's nothing legal.
So good afternoon again, Director Murphy, Chairman Bosky, and members of the board. And thank you for having me back again to speak on this important topic. As you may know, I submitted a correspondence to the board on March 7th with some attached studies. I do want to comment on those a bit, but first, it came to my attention that Yarmouth itself has no tobacco control division. As a result of which, I want to introduce to you the de facto tobacco control division in Yarmouth, which is made up of your local retailers here, who have been here, week in and week out while these hearings have been taking place. And these are the individuals that invest time and money to train their staff to ensure that staff does not sell these age-restricted products to minors. Some of them even have in-house programs where they arrange for an underage individual to attempt to make a sale from their own clerk. If that sale goes through, they actually may terminate their own clerk and start that whole training process over again. So these individuals are really at the front lines of this fight to reduce youth tobacco use, and I just want to make that clear and suggest that they are in fact your allies in this fight, not your enemies. And any regulations that are being considered should take that fact into consideration. But getting into the studies that I submitted to the board. So from my own reading of these studies and from our prior discussions, there's two sort of overarching principles that I've gleaned. The first being that the regulations currently under consideration are incongruous with regulations that are in place in Yarmouth and statewide in Massachusetts. And that's true for two reasons. If you look at the other age-restricted products, if you look at alcohol and marijuana, PUP laws, as we've discussed, apply.
For people listening, why don't you say what that is?
Sure. So PUP laws PUP stands for purchase, use, and possession, and PUP laws actually make it illegal for one to purchase, use, or possess whatever product the laws are being applied to. In Massachusetts, they apply to marijuana and alcohol and not to tobacco. So the reason I'm saying that the regulatory framework that you're considering is incongruous in Yarmouth and in Massachusetts at large is because you're not considering PUP laws yet, at least in the draft regulations. And those do in fact apply to marijuana and tobacco. And the regulations that you are considering is they're enacting this sort of piecemeal regulation on a class by class basis. What I mean by that is, first they approached certain classes of flavored products. Next, they're exempting. They're considering doing away with an exemption that was contained within the first set of regulations applicable to mint, wintergreen, and menthol. And they're also considering going further and restricting the sales of vape products altogether. So it's this sort of piecemeal process that seems to be being followed that is not being followed with respect to marijuana and to alcohol. And the same concerns, frankly, apply with respect to marijuana and alcohol because you have flavored products. You have vanilla vodka. You have cognac flavored liquors. You have Fireball, which is something that, a candy based on a candy that children use. And the same applies to marijuana as well. You have edibles created with THC that are filled with sugar and appeal up to children and adults. So the point being, the products present similar concerns. They're not being treated the same under the regulatory framework you're considering. So why I would pose the question to the board, and obviously I don't need an answer now, but I think it's something that is important to consider. Why treat tobacco differently than marijuana and alcohol? Why not bring it under the same regulatory framework? And only when that regulatory framework has been demonstrated to fail, then take this divergent path where you're sort of trying something new and different, which has never been tried with any of the other age-restricted products. Secondly, the solution, as I see it, based upon the studies and the data, is that PUP laws should be enforced, along with education for children and merchants, educational programs, and the implementation of harm reduction policies. That is sort of the sum total of the conclusions that I've gleaned from the studies that I've presented to the board and from the discussions that we've had. And so getting into some of those specific studies, you may recall the first one that is attached to my March 7th correspondence, which is a study out of the New England Journal of Medicine, published on January 30th, 2019. And in that study, the authors or the scientists behind the study, essentially recruited a population of approximately 900 people, 900 people who were motivated to quit smoking. Split that population roughly in half, assigned half of those people to try and use e-cigarettes as a way to facilitate smoking cessation, assigned the other half of those people to traditional nicotine replacement therapies, or NRT. NRT involves such things as, nicotine lozenges, nicotine patches, nicotine gum. So again, it's another way of getting nicotine into your system without actually having to use the traditional combustible cigarette. And e-cigarettes, we would argue, sort of provide the same benefit. They provide a way of getting nicotine without presenting the dangers that combustible cigarettes present. So that study.
Just interrupt. There were also
Sure.
involved some therapy and some sessions with an expert for the subjects in the study. That was part of
Yes, it
treatment
did.
as well.
True. And that study ultimately concluded that 18% of the individuals assigned to the e-cigarette group were able to completely quit smoking, and 9.9% of the individuals assigned to the NRT group were able to completely quit smoking. So you have almost a twofold success rate in the e-cigarettes over the NRT group. And so, we would conclude that that e-cigarettes present an incredibly effective way or means for smokers to actually quit smoking, to get off of cigarettes. And even better than your traditional NRT therapies, which are often, suggested by doctors who are trying to facilitate their own patients to get off cigarettes. That study also raises a few interesting additional points. So the study lasted for a period of a year, and during that period, there wasn't a single adverse health consequence in either of the two groups that was attributed to the products being used in those two groups. So neither in the e-cigarette group product or the NRT group product was there a significant adverse health consequence. And I know there's been a lot of talk from some of the proponents of the regulations about how unhealthy e-cigarettes are. So I wanted to raise that as being valid. E-cigarette. They also found that e-cigarettes provided better user satisfaction, so that sort of facilitated that group in being more successful as well. Another thing to note is that there were some additional points the study raised. Some of the individuals before the study began reported phlegm and or coughing as sort of a baseline symptom of their use of combustible cigarettes. After the year had concluded, those individuals in the e-cigarette group actually reported higher levels of a cessation of those symptoms altogether, as when compared to the group in the NRT group. So the individuals in the NRT group. So that's also relevant to note that some of the symptoms commonly attributed to inhaling anything were not actually showing up and were being reduced at greater levels in the e-cigarette group as in the NRT group. So, I think the study highlights the efficacy of e-cigarettes in facilitating quitting. Furthermore, it advocates some of the harm reduction benefits of e-cigarettes, and those benefits are highlighted further by a letter by a letter that I believe the board received from a PhD pharmacologist by the name of Carrie Wade. She works for the R Street Institute in Washington, and I believe she sent a letter in, and I believe so. There's a few salient points in that
Can I just
letter.
interrupt for 1 second? Is it okay?
Sure.
Just in reference to the first study, okay? It's a medical journal that I do get, and it was a good choice on your part, okay? It's very up to date, and it's a good article and summary of the study. But I need to point out you neglected to include the editorial pieces on the study, and there were 2 of them in the journal. And they did point out some problems with the design of the study. And that does not necessarily mean it's pro or con for whether it's e-cigarettes or alternative methods. And I don't think I need to go into the details of that. But there's a very interesting statistic that is in the article that you didn't mention just now. And that is after 1 year, the people who were absent, who hadn't been smoking, of the individuals using the e-cigarettes, 80% of them were still using nicotine products. Only 9% of the people who had used alternative methods were using nicotine. So if you're using alternative methods or ones that really are established, only 9% of the people were still addicted to nicotine, as opposed to the group on the e-cigarettes, 80% of them were still addicted to nicotine. I think that's pretty significant.
Sure. So there are several additional data points that I didn't include. For example, among the two groups, even for those individuals that were not able to quit entirely, the individuals in the e-cigarette group had a greater reduction in combustible use than those in the NRT group, and that was measured by carbon monoxide levels in the blood. There's several other data points that I didn't include. I only didn't include those as a matter of expediency. Furthermore, it gets into a different argument, which is that nicotine addiction is bad in and of itself, and I don't think that's necessarily the same sort of consideration that the board is facing, because there's plenty of things in society that everyone's addicted to. I drink about 4 cups of coffee a day. Whether it's bad or good, I don't know. I do it because it helps me stay awake and do my job. But whether addiction in and of itself is bad is, I think, a separate topic. But I do understand your point.
I don't agree it's separate. I think the main concern, at least for me on the board, is we do have an epidemic, and I'm not just focusing on kids. I'm really focusing on adults as well. This is new. This is very new. Caffeine is addictive in some ways. Yeah, withdrawal, you'll get headaches and so on. But nicotine and heroin, and I think it's cocaine, would probably be the most addictive 3 substances there are. I drink a lot of coffee also. We're talking about 3 other types of substances that are incredibly addictive.
Sure.
So you're talking on the level of heroin and cocaine. I'm referring to nicotine.
And I do completely appreciate that point. I guess the last thing that I would say in response is just that if individuals are going to be addicted to nicotine, and that's something that's not entirely within the board's control, I think it's certainly better to have those individuals using electronic cigarettes as opposed to traditional combustibles, simply because of that harm reduction element. But I'll move on to my next point, which is the second study, which analyzes the efficacy of PUP laws. And that study, before the authors even approach the own factors of their own study and the results of their own study, they do a brief review of previous studies on the same topic, which have essentially assessed the efficacy of PUP laws in other towns, other states. And they talk about how a lot of other findings have been positive with respect to the efficacy of PUP laws in reducing youth use of tobacco or nicotine products. Specifically, one study was mentioned where 4 counties were studied in the state of Florida. 2 of those counties had the highest enforcement rate of their PUP laws. 2 of those studies had the lowest enforcement rate of their PUP laws. Among those two sets of counties, the 2 with the highest enforcement rate of PUP laws had a much reduced tobacco usage rate among the youth for the 30-day period of the study. And there were other similar examples that they cite at the beginning of their study. Now, their study itself takes into account 24 individual towns in Illinois with existing regulations, which included an age restriction at the time it was 18, signage requirements, so stores had to have certain signs in place with respect to that age restriction. And then there were educational programs in place, as well as compliance checks, and those compliance checks could be penalized by a loss of license. So that was the existing framework that they were working within. The sort of variable that they were looking at was whether PUP laws would have any sort of measurable additional effect. And what they found was that the primary effects that they measured were what they would refer to as ecological or normative effects within the communities that had enacted the PUP laws. And the 2 sort of normative behavioral changes that they were taking a look at specifically were a reduced use of products among the youth, and then reduced perception of youth use among the community as a whole. And they essentially concluded the study saying that PUP laws were the most important part of any regulatory framework approaching tobacco in their minds. In my understanding of those two factors, the reduction in youth use combined with the reduction in the community's perception of youth use, is that it creates a positive feedback loop that basically continues indefinitely. So you have youth use reducing, and then you have the entire community seeing that and perceiving a reduction in youth use. Because of that, you have reduced social pressure, whether real or perceived, so children and the youth use the products even less. And again, less use results in less perception of use, and that feedback loop continues ad infinitum until hopefully the tobacco usage is so low that it's no longer a problem. So I think what you can glean from that study is that PUP laws truly are effective. Enforcement is key, and that is something that is raised in the beginning of that study. So putting it on the books and ignoring it isn't the solution. Putting it on the books and making sure the town enforces it and takes it seriously, in combination with some of the other things that they had in place. So in combination with educational programs and harm reduction policies, I think is the most sensible overall regulatory framework to use. And that also mirrors the framework that's in place for alcohol. Marijuana is new. Maybe the educational programs aren't in place, but it does mirror what's in place for alcohol. One other thing to mention is that, and this sort of highlights another incongruity, is that in Massachusetts, there's a particular law on the books. It's Massachusetts General Laws, Chapter 270, Section 6.
What was that? I didn't get the number.
It's Massachusetts General Laws, Chapter 270, Section 6.
Okay, thank you.
And it actually permits a parent or guardian to provide tobacco products to their children.
Okay.
And obviously that's not the case for alcohol. It's certainly not the case for marijuana. And I think it just goes to sort of highlight the incongruity, and I think we need to bring tobacco within the same regulatory framework as marijuana and alcohol has been under for decades. I think that is the most important first step. It follows from the studies that are available, the studies that I presented to the board. And if that fails, if it's shown to fail as to tobacco in ways that it doesn't fail with respect to alcohol and marijuana, then maybe down the line you consider taking some divergent, unique path that applies only to tobacco for reasons that become apparent to the board. But as things stand, I don't see any reason why it wouldn't be brought within the same regulatory framework that we apply to alcohol and marijuana. The one other thing that I'll note in closing is that an additional letter was submitted. The individual submitting it didn't have time to submit it to the board directly by the deadline that we had mentioned. He also wasn't able to make it here on his own. It's less than a page. If I could read that into the record, I also have copies for the board. It is from an individual by the name of Richard Marianos, and he is the former assistant director and special agent in charge of the ATF's Washington Field Division. And so this is his perspective
You have
on
this? We don't, so have you seen it?
No, I think because it came in late, I believe that's.
So he wasn't able to submit it in time, which is why.
Not submitted. I thought he wasn't.
No, he
gonna
wasn't
be
able to submit
present.
it. He wasn't able to submit it and wasn't able to show up. So he's asked that I read it into the record, if that's okay.
I'm fine with that.
Okay. So these are his words. Thank you for the opportunity to submit testimony on Yarmouth's deliberations on potentially banning the sale of flavored tobacco and nicotine products within the community. My name is Rich Marianos. I'm a former assistant director of the Bureau of Alcohol, Tobacco, Firearms, and Explosives. As a former agent with experience in tobacco law enforcement, it's clear from the outset that banning flavors in an attempt to prevent youth access to tobacco and nicotine would largely be a symbolic gesture. It would only be a matter of a few miles for consumers of these products to obtain them in a nearby jurisdiction, especially in a state like Massachusetts, which may lead some to assume that the real intention of Yarmouth's proposed regulations is to create a domino approach in which communities across the Commonwealth ban flavors. On the surface, that approach is problematic, as it would only take a few communities looking for an arbitrage opportunity to undermine the strategy. But more importantly, it would be counterproductive due to a major unintended adverse consequence that I would like to focus on today. Contraband sales are already big business in Massachusetts, and almost certain to get bigger if more than a third of all cigarettes and almost all vapor products are suddenly taken off the legal market. A 2015 report by the National Academies of Sciences, Engineering, and Medicine NASEM for short, estimated contraband even then at between 8.5% and 21% of cigarette sales annually, or 1.24 to 2.91 billion packs. The latest estimates by the Mackinac Center found Massachusetts ranked 7th in the nation for most contraband cigarette sales. Research suggests that up to 87% of menthol sales would simply shift to black markets, even in the case of a nationwide menthol ban. Black market sales are not subject to the legal or industry oversight or restrictions on youth purchases at retail. Very simply, criminals selling loosies or bottles of e-liquid on street corners or out of car trunks near schools don't check IDs. So even a statewide ban would virtually guarantee greater youth access to nicotine products, and that result could potentially reverse recent declines in youth smoking rates. In an unregulated environment, contraband cigarettes and vapor products are potentially far more dangerous for young people, as well as legal-aged adults. Counterfeit cigarettes are frequently adulterated, and contraband vapor products would be susceptible to similar adulteration with people mixing and selling their own batches without product standards. The adverse consequences of these proposals would generate must be considered. Thank you for your time and consideration. Again, that's from Richard Marianos, formerly of the ATF. Those are my comments. If you have any questions for me, I would be happy to answer them.
It would be helpful, we get a copy of that.
Sure, I have
That'd be
copies. I have
important.
7 copies of that. I can provide.
Now, you mentioned another organization. There was another letter, there was another person.
So there was another letter.
Beginning. Did we, I don't see it in my packet.
So I believe it was actually submitted to the board.
Looking for,
It was by a PhD pharmacologist by the name of Carrie Wade.
what group was it? Because it was a familiar name to me, not the person.
It's
but
the R Street Institute in Washington.
yeah, I don't know if you're familiar with it. It's a very political organization, very political. It's, so it would be, I could see why they would be writing the letter they did. I don't need to go into the details, but it's far from a very objective organization.
That being said, it is a PhD pharmacologist, and this is.
I don't
based
care
on-
what their letters after their name doesn't impress me one way or another.
And I really only pulled one salient point out of there, which is the fact that I'm not even sure if I actually quoted this, but so according to her, by the best available science, and again, this is coming from a PhD pharmacologist, no matter
Let's
where,
not go there.
no matter where she
Okay,
works.
that's not a good direction. I'll stand up for that.
Okay.
There are good physicians and lousy physicians.
Sure.
Okay.
So I will just mention, in addition to having a PhD in pharmacology, she got a master's in public health from.
You're pushing it here, okay? I don't care what his PhD or her PhD is in.
I'm just saying public health is different than a medical degree, period, because.
I was making an exaggerated example.
Sure.
Okay, that's all. So,
Can I just quote the one point that I was looking to quote?
sure.
So I may have said this in my primary comments, but according to her, according to the best science available, if only 10% of combustible cigarette users were to quit using cigarettes over the next 10 years and replace those with e-cigarettes, approximately 6 million lives would be saved by the year 2100. So that is the point that I intended to include in my comments. I don't know, I can't recall if I did, but that is the point that I wanted to pull out of her commentary.
Okay. I don't think the science is there for that. That's just my opinion from what I've read also. For that PhD to come up with it, I don't think the science is there, period.
And that's perfectly fine. I think I hope that you don't, I hope that you don't refuse to consider previous comments which are based on the studies that I provided the board based simply on that one.
Certainly not. No, you've done a great job.
Sure.
I mean, you've been incredibly organized, succinct, and the materials are great, and it's a compliment to you. Really, I feel that strongly.
Appreciate it. Thank you very much.
Yeah,
for
I'm just going to mention one point about the different strength of nicotine in the vaping, whether it's 3% or 5%, whether people can wean their way off depending on the percent. You really didn't touch on that too much, or in the studies.
So in the study that was out of the New England Journal of Medicine, the initial product that was provided to the participants was 18 milligrams per milliliter, but they were free to choose, after they finished that product, they were free to choose whatever product they wanted as long as it was generally within the class of e-cigarettes. So there was no control for that after that first device that was provided to them.
Yeah, there's not a lot therapeutically that's set up to help people kind of wean themselves off the nicotine. The major companies, if you go online, the highest concentration generally is 18 milligrams per milliliter. If you look at the Juul products, they have three, if I'm not mistaken. One's 3%, and the other's 5%. 3% has like 35 milligrams per milliliter, and that 5%, which is incredibly popular, is 59 milligrams per milliliter. I mean, it's pretty awful, is what that is. That's how concentrated. And the feeling when you're inhaling that is very different. It's the reason why it's as popular as it is. And could certainly lead to a lot of withdrawal symptoms, which are pretty awful.
You know, I would say if that's the concern of the board, I think, you know, restricting the content would be a better solution than banning the product altogether. But and I think that's perfectly within the board's purview as well. If you were to say that, you know, only 3% maximum could be sold within the town of Yarmouth, then that's something that, you know, would have to be enforced.
I don't know if the board has, you know, the authority to do that. If you could hear from store owners their opinion on that, what you just said, that I'm sure we'd be happy to listen to that.
Sure. I mean, just from a logical perspective, I would say that if the board has the ability to enact the regulations that are currently being contemplated, then certainly it has the ability to enact a variation of those regulations, which would regulate the content or percentage of nicotine in the products.
Yeah, it's the big tobacco companies. It's a problem. We're a town here, and we, you know, in the best interest of the town, we can't afford to get sued by the tobacco companies. So there are a lot of regulations out there. This is just a Board of Health in a small town, and we're trying to look out for everyone here. So there are some budgetary issues when it comes down to legality, which I'm sure as a lawyer you can understand that.
Understood.
Any board members, everyone's kind of quiet. Any questions? This is a good time. You're obviously very knowledgeable. So, comments, questions, anyone?
I think I'm pretty clear where he stands.
Okay. All right. Thanks for coming in.
And my last comment will be just to remember, the only reason I get into the details of the products is because at the end of the day, I'm looking out for the best interests of the store owners, and I know that the details of the products concern you. So that's why I try and address those things. But at the end of the day, you know, I'm here to make sure that the store owners can continue selling legal products and essentially not be put out of business. But that's, you know, I'll close there, and I'll let others contribute.
Okay. Thank you again.
Thank you very much again for the ability to speak.
Got a lot of people here. Somebody, come on up. We're here to listen.
Well, hi, Dr. Bosky and members of the board. I'm Dr. Michael Siegel. I'm a professor at the Boston University School of Public Health. I'm a physician. I'm in the Department of Community Health Sciences there. And for the past 32 years, I've been doing research in the area of tobacco, as well as serving as a anti-tobacco advocate. I played a major role in lobbying across the state for 100% smoke-free bar and restaurant regulations. I worked with colleagues at the Massachusetts Municipal Association and the Mass Association of Health Boards on promoting smoke-free regulations throughout the state. I've also consulted and helped numerous individual boards of health on their smoke-free bar and restaurant regulations. I've also testified as an expert witness for the plaintiffs in tobacco litigation against the tobacco industry in 8 separate trials, including the Engel case, which resulted in an unprecedented $145 billion verdict against the tobacco companies. And I've published nearly 100 peer-reviewed articles relating to smoking and tobacco use. So in short, I'm a long-time committed anti-tobacco researcher and advocate. Today, I want to call your attention to one particular age group of residents of Yarmouth who are using flavored e-cigarettes in record numbers. In fact, the use of flavored e-cigarettes and vaping products is running rampant among this age group. Throughout the country, a recent survey of this age group revealed that 85% of them actually prefer flavored e-cigarettes, including 74% of them who use fruit flavors and 66% who use dessert or pastry flavors. And nearly half, 49% of these vapors in this age group used candy, chocolate, or other sweet-flavored liquids. Now, if you think we're talking about teenagers, think again. The study in question was a survey of adult vapors in the United States, specifically adult ex-smokers who had quit successfully using e-cigarettes and who are currently relying upon these products to keep them from returning to smoking. While there were 16,000 of these former smokers in the study, national estimates suggest that there are at least 2.5 million adults who rely upon e-cigarettes to keep themselves off highly addictive and deadly tobacco-burning cigarettes. And most of these former smokers are relying upon flavored e-liquids because the whole point of vaping for adult smokers is to get away from the taste of and dependence on tobacco. Now, it is true, of course, that a very worrisome proportion of youths are vaping and juuling, even worse, and most of them, like their adult counterparts, enjoy flavored as opposed to tobacco-tasting e-liquids. But even more worrisome to me is that the Board of Health may end up inadvertently throwing former smokers under the bus by severely restricting the sale of e-cigarettes. And I think this is kind of the idea of what it means to throw the baby out with the bathwater. Let me explain what I mean. So here's the problem. While youth vaping, and especially use of Juul, is a serious problem, the reality is that youth are not the only ones using these products. E-cigarettes are responsible for at least 2.5 million former smokers having quit smoking completely. If these products are taken out of convenience stores, it will likely cause a large number of them to return to smoking because it will become much easier for them to just pick up a pack of Marlboros rather than to hunt down a smoke shop or a vape shop, which are much harder to find, especially in small towns. As was mentioned before, a recent study in the New England Journal showed that these products are twice as effective as a Nicotina patch for smoking cessation, and they're truly a lifesaver for literally millions of former smokers. My concern is that the proposed regulation would eliminate the sale of all e-cigarettes at convenience stores, but it would allow the majority of cigarettes to continue unabated. This means that it will actually be easier for former smokers and also for youth to get access to a Marlboro than a cherry vape. So what possible justification is there for eliminating the sale of fake cigarettes at places that are accessible to minors, but allowing the real ones to continue to be sold? Not only will this likely result in many former smokers going back to smoking, but it may also lead to many youth figuring out that it's much easier for them to smoke than to try to track down an e-cigarette. The last thing in the world that boards of health should be doing is to give tobacco cigarettes, which kill more than 400,000 Americans each year, a competitive advantage over fake electronic cigarettes, which contain no tobacco, involve no combustion, and are much safer than combustible cigarettes. My message to you today is that there simply is no public health justification for banning electronic cigarettes, but allowing combustible tobacco cigarettes to remain. I believe that the regulation under consideration is inconsistent with the mission of the Board of Health because it has no public health justification. What possible justification is there for removing e-cigarettes from convenience stores, but allowing those very same stores to sell Marlboros and Camels, which are two of the most dangerous consumer products in history? I believe that there's also a legal problem with the proposed regulation. By choosing to ban menthol cigarettes, but leaving all other cigarettes untouched, the Board of Health would be making a decision that I believe is arbitrary and capricious. Essentially, what the board would be doing is to ban Newport Cool and Salem sales, but to allow the continued unfettered sale of Marlboro and Camel. There is no public health rationale that I can see for singling out certain brands for a sales ban, but not others. As I'm sure you all know, these brands are equally deadly. In fact, the scientific evidence shows that menthol cigarettes are no more dangerous than non-menthol cigarettes. The FDA has made it clear that there is no cigarette brand that is safer than any other cigarette brand. And in fact, it is illegal for any cigarette manufacturer to claim that its brand is safer than any other brand on the market. Is the Board of Health actually prepared to argue that Marlboro cigarettes are somehow safer than Newports? The data on cigarette brand preferences among youth also do not provide a justification for banning menthol cigarettes and giving non-menthol cigarettes a huge competitive market advantage. In fact, the majority of youth smokers prefer non-menthol cigarettes. The overwhelmingly most popular brand among youth smokers is Marlboro, with Newport a distant second. How does it make sense then for the board to ban Newport sales, but not the sale of most Marlboros, which are in fact the brand that is overwhelmingly preferred by the majority of youth smokers? Although the proposed regulation would restrict the sale of menthol cigarettes, it leaves entire shelves of non-menthol cigarettes unregulated and easily available. These are the very cigarettes that are the most prevalent among both youth and adult smokers. In summary, public health laws by definition must have the effect of protecting the public's health and saving lives, and they must not be arbitrary. The proposed flavor ban will actually harm the public's health by making it more difficult for ex-smokers to choose a less harmful option. Moreover, the regulations are arbitrary and capricious because they regulate cigarette brands differently without a valid health justification. The proposed regulation does a huge favor, not for public's health, but for Marlboro, which is going to see a windfall in the ex-smoker market as all of its competition from vaping products and most of its competition from the number 2 brand Newport is eliminated. If you really want to protect the public's health and are sincere in wanting to reduce tobacco-related disease and nicotine addiction, then there is an option that is readily available. Restrict the sale of all nicotine-containing products, electronic cigarettes and all tobacco cigarettes alike, to adult-only establishments. This would allow vaping products to compete with cigarettes on a level playing field. It would avoid the incentivization of former smokers to return to smoking, and it would protect youth from easy access to vaping products and tobacco cigarettes, all at the same time. I urge you to set an example for boards of health across the state and nation by restricting the sale of all combustible cigarettes, and certainly not just e-cigarettes, and not just menthol brands, to adult-only establishments. Thank you very much for the opportunity to share these thoughts, and I'm happy to answer any questions
Thank you.
that you have.
The concept of restricting sales to adult-only stores, it seems to make sense when you listen to it. However, I personally don't see it to work and fair in this town. We have 31 stores here with tobacco licenses, and to select one store I think would be inappropriate for this particular town. Too many people have businesses here, so I don't think that's a route this town can go or should go. Once again, that's not the board's opinion, that's my opinion. One thing you really didn't address, there are other alternative treatments for people who have addiction to nicotine. There are a lot of products. Some you need prescriptions, which can be expensive if you have to go see a clinician. Some are over the counter as alternative ways to meet the need of an addiction, as opposed to if you're not able to get an e-cigarette, there are alternatives. It's not just going back to combustible products. So I just want to make that point. There are other options out there.
And that's exactly why we need e-cigarettes, because the success rate with those options is very, very low. In fact, the overall percentage of smokers who quit with all those other options in a given year is only 3%.
I agree, but it's also, we don't know if it's any good for the e-cigarettes as well. We have no idea. We know they'll 80% of them are still, assuming they were successful 1 year, 80% of them are still going to be intaking nicotine in some form or another. The other thing is the products that have been out there a long time. If you go to Chantix, you can look. There's 20 years of material there. Right now, we're dealing with the e-cigarettes, and as a physician, I'm sure you can appreciate there are a lot of chemicals that we're getting exposed to when you're inhaling them. You're talking about formaldehyde. You're talking about acetone. You're talking about toluene. These are, paint thinners. You're talking about nail polish removal. Formaldehyde, I think it's all kinds of products, isn't it? I mean, it's like a glue almost in some ways. I mean, so that's unknown. I'm just saying we don't know where that's going to go 10, 15 years down the line. We certainly know that tar is awful. It causes cancer. I'm not denying that. But there are a lot of products out there with a track record.
So the problem is that they do have a track record, and the track record is dismal. If I went into my physician with pneumonia and he gave me a drug, and then as I'm walking out the door, I said, oh, by the way, what's the percentage that this is going to work? What's the chance that this will actually work? And he said 3%. I would say that's malpractice. How can you give a person a drug that has a 3% chance of working? This is exactly why we need an alternative, why smokers need an alternative. I'm not comfortable telling the 97% of people, my patients who quit, look, we're sorry. That's the only thing. If nicotine replacement didn't work, sorry, we're just going to throw you under the bus. You're not important. There's nothing we can offer you. I'd rather tell them, look, there is an alternative that 2.5 million people have used. Is it perfect? No. Do we know that way down the road there might not be some side effects or some harmful effects? No. But we know what's going to happen if you continue to smoke. You're going to die. You're going to get disease. 50% of smokers, long-term smokers, die from their smoking. So we know that person's going to have a 1 out of 2 chance. I'm willing to take the risk that there is some slight chronic risk of using electronic cigarettes if I can save this person's life right now. And that's why I think it's critical that these products remain available as an option. And I think that the biggest problem to me is taking away the option of electronic cigarettes, but leaving the option of cigarettes. To me, that doesn't make sense. I don't see a justification for basically taking away a product that is much safer and letting the more hazardous product remain on the market. That's the problem that I just don't see, and that's the part that I think is problematic from a legal perspective. I don't think there is scientific evidence that can justify what I would view as an arbitrary and capricious decision to take less hazardous products off the market and allow the more hazardous ones to remain.
What would happen if you're removing the flavored tobacco from cigarettes? What would be the result of that? In other words, it's going to be less pleasurable. I mean, I don't know. You'll probably know the statistics better than I would. It's like 30% of the people have menthol cigarettes. Is that what they prefer? I mean, kids, it's much higher than that. But what would happen then? If you banned, well, there are only 3 flavors left. For some reason, my guess is the big tobacco stores somehow negotiated their way through a deal to the government saying, well, these 3 flavors are not flavored or they'll be okay. And it's probably the history of it. But
So I think what would happen if you banned flavored cigarettes is that people would switch to the other brands on the market. It would be a windfall for Marlboro. I mean, it would be a dream come true for Marlboro because their competition right now comes from Newport. Newport's the number 2 brand. And why are they getting competition? Because Newport sells largely menthol brands. And so if menthol was taken off the market, Marlboro would be celebrating in the streets because a huge amount of those menthol smokers would switch to Marlboro. So taking menthol off the market makes no sense, because all it's doing is switching smokers from one brand to another, both of which are going to kill them. And I don't see that the board has an interest. I don't think there's a government interest in deciding that certain brands of cigarettes should be allowed to be sold, while others that are equally deadly should not be allowed to be sold. I just don't see the justification for that.
You have great arguments. No, the issue is if someone is unable to get menthol cigarettes, so smoking could be a rather unpleasant experience for some of those people. So I'm not sure everyone is going to go to Marlboro as a source for their nicotine. I don't know how many would. You probably would know more than I would. But it wouldn't be a pleasurable experience. If you look at the same issue of the New England Journal of Medicine there, they talked about the natural process that in behavior, that we all eat and drink. That's a natural process for us, which smoking is not. We weren't born with that for survival. So if it was unpleasant, like you're stuck with Marlboro, there may be a lot of people would choose not to go the route of continuing to move on to Marlboro. They may do something else. I'm just throwing that out there.
I mean, that's true, but if you take all cigarettes off the market, there's a much less chance that they're going to switch to something else. And I think the other thing that's important to point out is that menthol is not the only flavor that's used in tobacco. All tobacco uses flavor. All cigarettes use flavors. There's chocolate in Marlboro cigarettes. There's ammonia that's put into almost all brands of cigarettes, which increases the nicotine delivery, just like the Juul does. It's essentially accomplishing what the Juul salt, the nicotine salt that's used in Juul, is essentially accomplishing the same thing that Marlboro discovered in 1965. They could do by adding ammonia to the tobacco to change the pH and to allow it to be absorbed more quickly. So it's not, there's nothing unique. I guess what I'm saying is there's nothing unique about menthol that I see a justification for separating it out. Yes, menthol is a flavoring that some people enjoy, but all other cigarettes have other flavorings and other additives that help enhance their addictiveness as well. And so if we're going to start going down the road of saying, well, we don't want to allow products that have flavors in them or that have mechanisms to try to enhance addiction, then we would really need to include all the other cigarettes because they all do the same thing.
I wasn't aware Marlboro had chocolate in it. Now, how do they get around the regulations that are federal regulations, not Yarmouth regulations?
So right now there's no federal regulation against putting chocolate, strawberry, cherry, or anything that you want in your cigarette, as long as it's not a characterizing flavor.
Okay.
So there can be chocolate in there. If you tasted the cigarette and it tasted like a chocolate bar, then that could be said to be a characterizing flavor and it would be banned by the FDA regulations. But if they put chocolate in there to enhance the taste and give it a little taste of it that you can kind of get a hint of it, that would not be outlawed.
Who makes that determination? I mean, is that in a lab or is it very subjective? We've been through this already where some of the stores end up having a pack of something and it's flavored, and it's been really difficult here for the store owners. And so it can be very subjective. So how does the government handle that, of chocolate or not chocolate in your Marlboro?
So unfortunately, there is no objective way to do that. It is just like many things in the law, it is a subjective decision. Okay. It's whether or not this is a characterizing flavor. And so presumably you would give it to people and have them try it and then to try to answer the question, would you consider that a characterizing flavor? But I agree, it's very subjective.
So, I mean, you have a lot of expertise. I mean, I've read a lot of your materials. And so where are things going to be 10 years from now in this country, and tobacco and nicotine? What's down the line?
Well, I think that my hope, at least, is that what's going to happen is that the FDA is going to take stronger control over the e-cigarette market. And promulgate regulations that will enhance the safety of e-cigarettes. I think e-cigarettes have tremendous potential, but I don't think they're there yet. And the reason I think they're not there yet is because they have not addressed several important points. The first one is battery safety. We can't have exploding batteries. That just doesn't cut it. And the second thing is we can't have, you mentioned acetaldehyde and acetylene and other aldehydes. The reason they're getting into the vaping, into the aerosol, is because the temperature is the products are getting overheated. When you get over 350 degrees, you get these unwanted products. The studies that have been done of vaping aerosol that's vaporized at only 150 degrees has not shown any of those degradation products. And so I think that my hope, at least, is that the FDA will step in and basically set a maximum temperature, a maximum nicotine level, a standard for battery safety that will ultimately take the crop of these products and make them much safer, and create a minimum quality control standard for all of the products on the market. So I do think that it is likely that as we move forward, I understand that this is scary because these are new products and nobody seems to think they know what's in them. But I think that it's not going to remain this way. I think that as we learn more, there will be regulations. There will be a much clearer understanding of what it is exactly that is dangerous and how we can mitigate those risks.
Why should this town consider having regulation for concentration of nicotine in the products? In other words, you mentioned that is one approach to this. Why shouldn't we consider that? As you know, the Juul products are sky high. It's scary, frankly. And I'm sure as a physician, any physician, they don't know what to do with it. Okay, I mean it's brand new. It's an epidemic, and I'm not teaching you anything. So why would that be something for a board to consider?
Oh, I mean, I wouldn't argue that it's not. I mean, I think it's perfectly valid to look at the nicotine level. The only caveat I would mention is that it's not just the nicotine level that determines the addictive nature. For the Juul, it's the nicotine formulation. So the thing that makes Juul unique from every other product on the market, with just two exceptions, what makes it unique is that it uses a nicotine salt. So it's a pyruvate salt. It's not the so-called freebase nicotine that's used in the other cigarettes. And because it's a salt, it's absorbed more quickly into the blood. So if you puff on let's say a Logic or a V2 or any cigarette that you buy at the convenience store, other than Juul, the nicotine level in the blood will go up very, very gradually, and then it will go down gradually. And that tends not to create an addictive pattern of use. But with the Juul, because of its absorption, it will actually spike, and then it will come down very rapidly. So you actually feel the nicotine hit. Vapors who use Juul consistently say, yeah, I can feel that. You feel the nicotine hit, so that gives you the kind of satisfaction. And then they somehow have rigged it so that the level drops rapidly, and so you're kind of left with that craving. So I think that needs to be looked. It's not just the concentration of nicotine, it's the type of nicotine. I think there would certainly be justification for regulating nicotine salt containing products differently than others.
Because withdrawal is pretty awful with nicotine. Could speak to some smokers. It affects cognitively, the entire somatic reactions. It's pretty awful.
Exactly.
Now, here we've been talking in town, the regulations of, I guess, having to be 21 to buy products and so on, and there's been a lot of issues about brain development. I'm not sure our brains are fully developed by 25 if it's in that ballpark. So right now we still have people who can legally buy the products, and certainly from what I've read, the inhalation of some of the e-cigarette is affecting development of brains in the young people, young being, let's say, under 25. What is your feeling about that?
Well, I completely support an age 21 limit for tobacco products, all tobacco products, including e-cigarettes. I think that setting the floor at 21 would have would address not only the issue about the brain development, but it also makes it easier to keep these products out of the hands of the younger kids. There's always going to be kids who are getting access to it.
We were all in
Right.
high school at one
We-
point. I mean, that's
Right, we know
obviously-
that.
It's easier now. You can get it whatever you want online. I was just giving the age of 25, for instance. Maybe that's when brain development for us kind of finishes up. It's further along than 21. That's all. I was asking your opinion about that.
Yeah, I'm not aware of specific studies that have differentiated between
Okay.
21 and 25.
Just asking.
Yeah.
Okay. Thank you. I'll stop talking. Everybody have some comments here? Questions?
I'll throw out
Director Murphy,
I'll
you're on.
throw out my same question on your studies on the former smokers that have switched to e-cigarettes to keep them off, or the juuling. Was there any difference in percentage? I know you just talked quickly on it, whether they were 3% or 5%.
I'm sorry. On which? No, I don't know. I don't know if there's been any studies to look at whether the success rate with the 5% concentration differs from the success with the 3% concentration. But one thing that we know for sure is that once Juul came on the market, they actually quickly jumped to 60% of the market. I'm talking about adult smokers.
Yeah.
So for adult smokers who are trying to quit, they've now overtaken the market, beating the tobacco companies at their own game. So, in a sense, the Juul is a double-edged sword. Truly, it's the definition of a double-edged sword. On the one hand, it is a great and clever product innovation because it's satisfying to smokers. The reason why many smokers try e-cigarettes and it doesn't work for them is they don't feel that hit, and they just give up. In fact, if you don't feel that nicotine hit on your first try of an e-cigarette, you're likely to just give it up. What is this? It's not doing anything for me. The reason why the Juul is so successful is that people try it and they're like, hey, this actually does do something for me, and so they can stick with it. Of course, it's a terrible sword on the other end because unlike the situation we had a year ago or a year and a half ago where we weren't seeing kids using e-cigarettes in a habitual fashion, now all of a sudden with the advent of Juul, we're seeing kids who are frankly addicted to the product. So it's a very complex issue, and I think what I'm trying to give you a perspective on is the importance of balancing the benefits for adults with the harms for youth and making sure that is all taken into consideration. And it's difficult, and that's what I tell my students is that's the art of public health. To me, the art of public health is making decisions in the absence of certainty and when there are competing interests. If we knew for sure what the science was definitively, we wouldn't really even need a board of health. A computer could just make the decision. So the art of this is really making those judgments. And I want to thank you for the opportunity to allow me to add this information, which I hope will at least inform your ability to make those judgments.
It's great. It's really been very helpful. At least for me, it has. Appreciate you coming in. Obviously, very knowledgeable. So thank you.
Sure. a
Anyone
pleasure.
else?
No, thank you.
Sure. And I will leave copies of this so that you have the full
Oh, fabulous. Good. Appreciate it.
testimony. Okay.
Excellent.
Thanks much.
We're still listening. It's still educational, I hope. We've got a lot of people out there. Come on, somebody must have questions, comments. This is the time. We're working hard at this. This is the fourth session, so we're trying to figure that out. It's complicated. It's complicated. That's it? No. Good, there we go. You make the effort of coming here. Come on, absolutely, just
I
sit
understand
down.
where you guys are coming from. I'm Kathy from
Okay,
South Yarmouth Mobile, Old Town.
I need you to repeat it, only you have to be
Hello.
next to the mic.
It's Kathy from South Yarmouth, Old Town.
Welcome back.
Thank you. You're going to kill our businesses. We struggle. We buy our permits. We sell milk. We sell eggs. We sell bread. We sell many other items. They're going to go to Dennis. They're going to go to Hyannis. They're going to buy their fuel there. I've spoken to several of my colleagues. They're going to close their stores. They're going to board them up. They're going to move out of town. And it's just going to kill our businesses. We're not trying to kill children. We don't sell to anybody under 21. You know we don't sell anything flavored. We abide by the rules. We do what we can, the best we can. We train all our employees. There are videos, there are tests. It's every quarter. Everybody has to pass. If you sell to a minor, if you do something stupid, you're fired immediately. That's how it is. And I'm just saying it's going to kill our business, and everybody's going to go to Hyannis and Dennis, and it's going to kill. I've been at my store for 23 years, and it's just going to put all of us out of business because they're going to go everywhere else for everything else. And that's all.
Just make one comment.
Yes.
I remember some restaurant owners were coming in, and they were talking about investing a lot of money of putting curtains up for smoking sides and non-smoking sides. I remember them telling them, you're probably wasting a lot of money because down the line, there won't be any smoking in the restaurants, and you should invest your money in some other way. It's too expensive to put up these vacuums, to pull out the smoke and the curtains and so on. I'm not a business person. But because of this, I've been doing a lot of reading, and it just seems to me the business of tobacco and of nicotine, it's changing. Regulations are coming. As you can see, there have been some issues over flavor in a lot of the towns. Some are banning, some are not, but it's happening that way. The age, the 21 limit, it's happening, obviously. And once again, I'm not a business person, but you may need to evaluate your business plan of how you're making a living, how you're running your business, because it's coming. It seems to be, and not just Yarmouth.
I understand that, but then do it on the entire Cape. We're a summer town. If they're going to come into Yarmouth, and I have to say, I'm sorry, you have to go to the town of Dennis, or you have to go to Hyannis to buy your Jewel or your Newports or your Marlboro Menthol, they're going to be very upset with us.
Maybe I wasn't
And
very,
we're all summer.
maybe I wasn't clear enough. I'm not pointing out just to Yarmouth. I'm saying what's happening in this country. For sure, in Massachusetts, but probably the whole country, it's changing. The business of tobacco. The previous speaker could probably have a lot to say about that. It is changing. And so making a living, if it's dependent upon it, it would be something to think about and to be proactive and not reactive in sense of the business. A lot of what we're struggling with here is obviously businesses in the town here versus some health issues. When I say it's complicated, that's what's making it very complicated. And so it's something to think about.
Well, I understand
and I don't
that.
mean a year from now. I'm talking down the line, and hopefully you're still in business, for sure, by choice, and that the times are changing. That's all. The laws are changing, and it's happening in our lifetime.
I understand that.
That's all.
Thank you. Do you know when you're voting?
We're going to be discussing that today, I believe, on the agenda. What are we going to do?
Okay.
Should we make an official public hearing or not? It's turned into that. This was really an educational session, number 4, and it's turned into sort of a public hearing. That's not what the intention was. Certainly, when we are making changes in specific ones in regulations, we have public hearings, and we have, it's come up on other subjects. We're never in a rush. We have as many as we can. So hopefully there's some discussion here. We'll see what the board has to say. What do we want to do starting today or for the next week? What do we want to do?
Okay,
So
thank you.
hopefully today we come up with some idea what's next.
Thank you very much.
Yeah, thanks for coming in. Just sign your name again.
Oh, okay.
Once again, no, print your name. Thanks again.
Thank you very much.
Somebody, all right. This is a great opportunity People are home, they can listen, opinions. Anybody have questions, anything? Okay. If not, we'll move along in the agenda here. Director Murphy, did you have anything to say before we move on here?
No.
No. Okay. So, the fourth item is discussion tobacco regulation draft. And it's, one more item before we go there, I apologize. There was a letter in our packet from the Community and Economic Development Committee, I think. Is anyone here from that group, from that committee? They sent a letter in. Unfortunately, no one's coming in to talk about it. Okay, we'll skip it. So, fourth item. So it's the time here to decide how you want to proceed with all this. So once again, I'll stop talking and let the board take over here a little bit. What do you want to do about all this? We've gotten educated. Public has had a lot to say, even though it's not an official public hearing. But what should the next step be of this board?
I'm not sure. I'm just not sure.
What are you struggling with? What are some of the pros, cons? I mean, this is our time.
Yeah, I mean, I'm struggling with. There's just great points on both sides. I see both sides of the coin, and I'm struggling on making a decision. At this point, I don't think we should move forward.
Anybody else?
Well, I was pretty comfortable with this until I heard that young man over there, and I don't want to jeopardize the chance of people that are trying to stay away from real cigarettes. I know what it's like to quit addiction, so, to take that chance away from anybody, I don't know. I'm not comfortable with it.
Anybody else with some comments?
Last weekend, I went on a family trip, and I saw a cousin of mine who was 18. I haven't seen him in 3 or 4 years, and he had a vape product.
Right.
I don't know what the brand was. Had nothing but trouble with it the entire weekend. It burnt a hole in his pocket, and he spilled the liquid on himself and walked around smelling like blueberries. And I told him what we were working on as a board, and he's 18. He says, do it. He said, get rid of Juul. 18-year-old who uses an electronic cigarette, he put Juul into a
I can understand the
completely
Juul,
different
but I can't.
category.
Okay, I got it.
Which I had not really realized that the delivery system was different, that it used the nicotine salt, and that it was any different than any other product, really. That was eye-opening, along with Dr. Siegel's information. It's probably not realistic to single out one product.
Yeah, I understand that.
In the draft.
Ban just Juul.
Right.
I don't know what it is.
Does anybody want to make a motion here? Okay, I will then. I seem to be doing all the talking. I'm not sure why I'm making the motion here, but my motion is we just stay where we are for the time being, and we'll move ahead with an educational program that the director and I have been working on for the school. We had planned on putting together an evening for parents, for kids. It's an educational video that we're probably going to be showing. We'll have some experts afterward, and we'll proceed with that. it's not really a motion, but I guess these are my opinions, that, and, we'll end up waiting and see what's going on with other towns, what's going to happen. So I make a motion, we do not proceed with evaluating or making decisions on specifics of the regulations. So just keep the regulations as they are now.
I second.
Any discussion? I know we've had a bit, but anybody? Anyone? Discussion?
Can I ask a question? So the motion is that
We're going to keep the regulations as they are for tobacco,
so any changes, it's on hold.
correct? Is that right? No, just in order,
To
for
clarify.
the wording of it, yeah.
Okay.
It's too convoluted the way I made the motion, but
No,
we're
that's
okay?
I listen now.
That's fine. So all in favor of the motion, raise your hand, please, and say aye.
Aye.
Okay, that's unanimous. Okay, so that passes. Okay. I don't know if anyone's interested for the fifth agenda. If they're not, you're welcome to leave.
We can take a 2-minute break. 2-minute break.
Kickbacks, draft, and corruption. Yeah, there we go.
You take it online, which I don't know how that would work.
You can't fail. I'm sure you can get, yeah.
You probably need a paper copy.
They make it that you can't fail. They just want to make sure you read it.
Oh, yeah, I'm making millions. Watch this shit.
They'll check your car. That's correct.
Blue ribbon thing, where is it, did she say it was?
Four Cs.
C.
Four Cs in the cafeteria this year.
Okay, when is it?
March 21st. I mean,
21st? Oh, that's it, right there? Oh, Jesus, I already got it.
yeah, it's not as convenient for us this year.
Oh, well.
I think they're trying to draw in a different audience.
Well, yeah.
The kids.
Yeah, and I'm surprised that other
Yeah, I don't get that.
that's the part I don't get. Like, why are they the only?
I'd love to get it away from
Why
the
isn't,
younger
why aren't
group,
other
but I
companies like, okay,
don't
well,
jeopardize the older group.
Was their patents are that good? I don't know.
That's crazy.
That was a very
You're eating?
interesting.
I'm telling you, that guy's spent his life doing this shit, so, he knows what he's talking about.
Oh, gosh. I was in Western Mass.
Yeah, up until I heard him,
My birthday was
I was ready to go, okay, we'll pass
And
this,
I
yeah.
went to Western Mass, and I went and checked out the marijuana. I was curious. I didn't get anything, but I was like, it is
You
like
know where to stick
going
it.
into the Pentagon.
You know where to stick it.
I've never in my whole, like, I've been to the Pentagon, and
Go
this was
back in your
harder
room
to get in than the Pentagon.
and play with your buttons.
I was like, to like
I am.
marijuana.
That's why I'm telling you,
I
go
wanted to,
back
I was
in your room and play
curious
with
how
your
it
buttons.
worked. So no, I could, but it was like, they check your ID like times, and it's very, I just was like, because this is not my jam. I've never, I literally have no clue. I was just like, it's unbelievable. And it's so well made.
Well, I will now that I know that that's what that means.
A lot of locked doors to get through.
Hey,
I just watched all the girls jump out there.
A lot of guards. Yeah.
I showed up with a fire engine.
Like, and I was
After the third person told me that my name wasn't on the list, and they didn't know all this bullshit. Huh?
We had 20 other people weren't on the list either.
I said,
I'm sorry you went through all that.
guy Trust me, when I want them to hear me, they won't need a microphone.
Back up. Let's go. Everyone's done? Okay, we're back, everyone. So the fifth item is training conflict of interest. Director Murphy.
Yes, this is the annual training for the board members and staff to take the conflict of interest training. You have a pamphlet in your packet, and I also sent you an email so you have a direct link. Takes about 45 minutes, needs to be done, I think it's every 2 years. So if you can do that online and then just bring the certificate in, that'll be helpful. Charlie will set you up a office that you can come in and do it at some point in time.
Tell me when. Okay, let me know when.
So if you can just do that before the next meeting, or by the end of the month, just
Okay.
drop off your certificates. Yep,
You done with conflict?
done with conflict.
That's good. Sign of growth. Anyway, next is approval of minutes. That was our January 28th, 2019 meeting, which was in your packet. I assume everyone went through it. Does anyone have any corrections? I had sent mine in, I guess, I don't know, Friday. Did I give it to you Friday? Thursday, last Thursday, whenever the day we got the packet. Does anyone have any corrections, edits? Well, it would be helpful what happens if someone has a correction they want to make right now? It's a problem, really. You really can't sign it if it's not
No,
really
it would
complete.
just go to the next meeting. I mean,
Yeah,
that's
it'd be
fine.
nice if you can, well, let me finish. It would be nice if someone, if you could send it in to Christine, if there's a change, send it in ahead of time, that's all. Email it to you, whatever. That, when it comes here today, it'll just be, better chance it'll be done and complete, that's all. That's a plug for you, that's
That's why I shot it to you.
yeah, okay?
For sure.
So,
And
It
then you
wouldn't
want me
hurt,
to
right?
Shoot it out to everybody?
Yeah, if they
I can
respond,
do
whatever.
that, and they respond,
It's helpful.
great.
That's up to everyone.
Yes.
People are busy, they can't always get to it, understandably so. So it'll get corrected here if someone doesn't get to it, for sure.
And a lot of that sometimes is grammar, because if it gets into a question of, did I say that, or what was the intent, we have to go by what was actually said,
Of course,
which might not be what was intended.
right. That never seems to come up here, but yeah, that's certainly, you're right, good point. Anyone want to make a motion here?
To get out of Dodge?
You're missing something.
No, I just, whatever that conversation was, I felt like I didn't understand.
You want us to go back?
Yeah.
Yeah, go back. What are you talking about, like, specifically?
So
Go ahead.
if you had, if Christine sends the minutes out to you ahead of time, and if you notice that if it's going through, if there's a grammar change or a comma or a misspelling, you can let us know. Or if you thought that there should be more of the content involved, you could mention. But if something was involved in that, because it's not verbatim,
Sure.
it could be, say, the way Christine took it down is the board member stated this, and it might not have been word for word. So as long as it's within the major drift of it, we're all set. But sometimes we've gotten, well, I really meant to say, well, we can't put in what you meant, but versus what you did.
I understand.
There's a gray area there
Now I
to
get
some degree, but yeah, it's just that it makes it easier for Christine if you get it ahead of time. That's all. Let's move on. How about approving them? Anyone make a motion here?
I move we approve the minutes of January 28th, 2019.
Second, someone?
Second.
All in favor?
Aye.
Aye, okay, that's the minutes. On old and new business, I have, I guess, one thought, which I just had, and that is, I really need, I need people to make motions, and it takes practice. It does. And, I mean, I was through it, and I had to learn it. I'm not very good at it, but I think it's important that everyone has to participate that way, and it takes practice. I mean, the way I run the meeting is pretty informal, dealing with Robert's rules. It's very loose, and you get help when you're making a motion, and normally in the Senate, that doesn't work that way. You really are helping each other in putting together a motion as it's happening. That's, in the strict sense, that's not how motions are made, but that's how, at least I think we should be doing it in an easy way. And the most difficult ones would be on the variances, I think, for the septic systems. And what I used to do is I would write things down that have come up, like if the floor plan is changed, this has to come in front of the board again, or we're going to put the date down of when the work has to be done by, and then read them a little bit. If indeed we're going to grant a variance. If we're not, it's very easy. You can make a motion, say we're not going to grant a variance. But it takes practice, and it's really falling upon Mary, who's making all the motions. And so I need people to practice, okay? And to make that effort. If I start making more motions, I'm the only one who's talking at all, and that really, it's I think, inappropriate. It's not uncommon for the chairs to doing all the talking, but certainly not the motions. So it just takes practice, and you get help. All right? There's no formality the way this board runs. There really isn't. It's pretty loose, and I feel comfortable doing it that way. So.
I'll issue one note just on the septic variances, that you can make a motion to approve the variances as presented. You don't have to read it all down. You can just approve the motion as presented, and then just add anything to it that it must be installed by, and just put the date in. So that could make it easier also.
Or if someone who's more knowledgeable made a suggestion about the design, you can write it down or ask that person, what did you say? If Bruce comes up with an idea, well, hey, why don't you put it in something else? Bruce can say it at that point, and whoever's making the motion will get credit for the motion. It's not going to be Bruce, but Bruce will put the words in your mouth. So that's what I mean by a looseness here. But I think I just thought that when I made the motion, what to do about the tobacco, and it just occurred to me, and that the burden has really been falling upon Mary. So.
Tell you what, I'll make a motion to try and make a motion.
Okay, I'll second that.
How's that?
Okay, well, anyway, what else we have? Old or new business, anyone? Something?
Can you maybe talk a little bit more about what you had said you had talked to Bruce about, the educational thing?
Yeah, it's about having an evening. You were already spoken to the principal, I think, at the high school.
Yeah, I think it was a follow-up from our last meeting where the board wanted to work with the principal on an education. The board wanted to see if they could work with the high school. I did call the high school principal, Morrison, said he'd love to work with the Board of Health to set up a meeting for parents and students, or really anybody within the community. So we're in the process of getting the auditorium, setting a date probably for after April vacation. So we're looking probably the last week of April, first week of May, to hold a education meeting. The principal thought probably 6 o'clock would be a good time, 6 to 7, maybe 7:15. We thought we could maybe show a short educational video on vaping that's very educational. We'll try to get Dr. Spellman from the hospital again, the doctor. I talked to the school physician, Dr. Colmer would be available to talk also, and maybe we'll get one other person and have a little panel for discussion afterwards. And we try to keep it to an hour. We'll notify, obviously, the newspapers. We'll try to get a call out to all the parents through the school, high school and middle schools, and then we'll try to use the town robocall to get outreach at the rest of the community.
Awesome.
And then we'll have a couple handouts. I think I placed one handout that I thought was pretty good in the packet here.
This one.
Would probably I was thinking making that one available. Unfortunately, it's on back order right now, so we're trying to push to see when they're going to get it available. They weren't even sure how long it's been on back order, when they're going to get it, so I've got to make another call to DPH to see when they can get that, and then we'll have a couple handouts. But I think what we heard from one of the last meetings when a few of the parents talked, they weren't sure of all the facts about vaping. Did it have nicotine in it? You know, the safety of it, and what could we get out to help the parents understand. So we're trying to look at it as an educational problem to discuss. So that would be end of April. As we start to look at our next Board of Health meeting, probably wouldn't be to the first Monday, I think is April 1st.
Yes.
I don't think there's any septic at this time variances pending, so I guess would either meet the first Monday in April or maybe the third if we have more on the education workshop. Right now, we don't have anything. We don't have, as we're not going forward with a regulation or a discussion at this time, we can probably wait to that third Monday in April, and then we can prep a little bit more for update a little bit more to get the public out there aware of the educational meeting.
Be easier to, let's schedule it, and then if we don't need it, to
I'll schedule, they're both scheduled,
Yeah.
April 1st and whatever the next
don't
date
need
is,
it, we can
15th.
cancel it. What else?
That's what we have right now.
Okay, so the meetings will return to 5 o'clock. Okay. All right. That's what everyone signed up for, was the 5 o'clock meetings. So, okay, anyone, here's a, see, the motions for the minutes and for adjournment don't count. Don't count. So, anyway,
You're no
we
fun.
do need one. A motion, that is, at this
I
point.
motion we adjourn.
Second.
Okay, any discussion? Seeing none, all in favor, say aye.
Aye.
Okay, thank you.
Okay.